Good morning, everyone. We're going to go ahead and get started. So we wanted to thank you for joining today's Project ECHO series on cancer survivorship. Today's webinar is on renormalizing healthcare for survivors and primary care physicians. The coalition, in collaboration with Project ECHO, is providing this series to primary care providers as an introduction to issues in cancer survivorship. So today, more than 2/3 of those diagnosed with cancer are told they can expect to live at least 5 years after diagnosis. According to American Cancer Society, in Nevada, there are currently an estimated 120,200 cancer survivors. And in 2019, 14,810 people will be diagnosed with cancer. So this series hopes to address survivors' ongoing needs with improved outcomes and quality of life for cancer survivors. So we thank you so much for joining. I would like to introduce you to, well, first off, myself. My name is Bridget with Nevada Cancer Coalition. And today's presenters, we have Lisa Thayer, Oncology Nurse Navigator at Carson Tahoe Hospital. This is Lisa's second career. So she used to be a chemical engineer and she worked in water treatment. She went back to school when her daughter was 3 years old, and she's worked as an oncology nurse for the past 10 years. She started at the oncology floor at St. Mary's and then worked as an infusion nurse at a larger cancer clinic in Reno, and has now worked as an oncology nurse navigator at Carson Tahoe for the last 1.5 years. And then we have Sharon. Sharon is an oncology patient navigator. She has worked in healthcare for more than 20 years, and most recently in oncology at Carson Tahoe Cancer Center as an oncology patient navigator for the last 5 years. She's also a 2-time cancer survivor, 40 years out from thyroid cancer and 3 years out from ovarian cancer. So I'm so happy to have both of you here and presenting. And could we get everyone to introduce themselves on the phone?
Yeah, so let's go around the group here. Alan, you want to start us off?
Yep. Okay. Hi. I am Alan Fisk. In Elko. I just do technical support for the group, and so if you're having technical issues or know somebody that does, please call Troy or myself, and we'll see if we can help.
Thanks, Alan. Then Sherry.
Good morning. I'm Sherry Glockner, and I am the Director of Care Management for Access to Healthcare Network.
Thanks, Sherry.
Morning.
Hi.
Morning.
Then Tara. Tara, are you there? Do we have audio for you? Oh. So you go off mute there, but it doesn't seem like we have a microphone for you. So if you could just write in on the chat box so everybody knows who you are, that'd be great. Then Judy. Judy, go ahead. I took you off mute. We should be able to hear you. Okay, maybe no microphone for Judy this morning. So then we have a 775 area code phone that's called in. Could you introduce yourself? Are you there? 775-971-4933. Can you hear us?
We have a bunch of shy people
I
this
know,
morning.
some quiet folks out there. Okay, well, thanks for joining us. If you can just write in on the chat box who you are, what you do, where you work, that kind of thing, that'd be great. And also feel free to write in if you have questions throughout the presentation. We want this to be really interactive, so yeah, let's make sure to do that. So we'll get going here then.
How do we make them go?
Just the clicker there, yeah. So the right little triangle will go forward.
The right, okay,
yeah.
Gotcha. Okay.
Okay, so today we're going to talk about renormalizing healthcare for survivors and primary care physicians. 40 years ago, when I had my first cancer, everything went through my primary care physician. He ordered all the labs, he ordered the ultrasound, he just ordered everything. And then when the results came back in, he sent me to a surgeon. After I had my surgery, I only had a couple of follow-ups with the surgeon, and then my primary care did all the follow-up after that. He ordered all the imaging and lab work and everything that I had to have. So things have changed dramatically since 40 years ago. Now we have survivorship care plans. So what exactly are survivorship care plans, Lisa?
So the survivorship care plans are a document that we send, that we give the patient according to the Commission on Cancer, who we'll talk about later. We are specifically supposed to give these documents directly to the patient and talk to them about it. I think most people in Northern Nevada, most institutions use the ASCO form, and I'll show you a copy of that on the next slide. We'll talk about how much time we spend on these survivorship care plans, and we're wondering, are the primary care physicians actually receiving these survivorship care plans? I was hoping there was going to be some primary care physicians so we can kind of get feedback about whether or not you guys are using these. Again, they're supposed to be given to the patient, but are the patients sharing them with their doctors? And are they getting into their charts at the doctor's office? And maybe are these a good use of the nurse navigator's time, or is there a better way to get this information to the primary care physicians and other doctors? So here is a generic ASCO treatment summary and survivorship care plan. There's a bunch of these that are tailored to each cancer diagnosis. So most of these are different. This is just the generic. So you'll see there's the demographics. You know, we'll have the different healthcare providers in there. The treatment summary, which, you know, talks about the pathology, talks about the staging, when the patient was diagnosed, whether they had surgery, what type of surgery, the findings. We also put in there whether they've had radiation or not, whether they've had chemotherapy, the types of chemotherapy that's used. We'll talk about the persistent symptoms that the patient has at the last visit with their oncologist. And then we'll put in if they've had genetic testing, the types of genetic testing they've had, and whether they've had genetic counseling, which really isn't happening a whole lot at our hospital. And then the follow-up care plan, which is probably the most important part of this for the primary care physicians. And this talks, again, this is generic, but in the follow-up care plan, each cancer will have the NCCN follow-up care plan guidelines for each cancer. Talk about the imaging, talk about the lab tests, and when these are recommended to be done. And that's what's in the survivorship care plan, the ASCO. Again, we use the ASCO because I feel like this is more healthcare provider friendly. It's concise and to the point. If we sent something that had more information on it, I'm always afraid that the healthcare provider is gonna look at it and just say, I don't wanna look at all this. So I want it to be tailored to the healthcare provider, but it's not tailored to the actual survivor.
So how much time do we spend on the survivorship care plans?
So each survivorship care plan takes 30 to 90 minutes approximately. We have to research, make sure we have the correct diagnosis, the correct staging, all of the treatment that was involved, you know, all the pathology that was involved. We have to chart on doing these survivorship care plans. We have to chart that we've talked with the patient. So we need to talk with the patient. That is specified by the Commission on Cancer as well. Every patient needs to have their survivorship care plan explained to them. And then the navigator has to track all of the care plans that were sent, when it was sent, who received the care plan. This all takes time from the nurse navigator away from patient care. It is patient care, but I don't know, is this the best way to spend time caring for the patient? At least 4 hours a week is spent on creating survivorship care plans and giving the survivorship care plans out. Again, that's 4 hours. Maybe we could spend it, be spending that time better.
Okay, so you've already explained somewhat what the survivorship care plan is, but can you tell us a little more about what it is and who they're for?
So again, I just want to go over, this is a form that contains pertinent information regarding the patient's cancer. And it's mostly tailored to speak to the healthcare professionals, not the patient. So they're easier to read if you have a healthcare background, if you're a patient who already knows all this stuff. And a lot of the patients are really informed. This is information that they would like to see, but it doesn't talk about psychosocial, it doesn't talk about support groups, it doesn't talk about signs and symptoms to look for recurrence, and what you don't need to worry about. They're not easily understood for the average patient.
So are these survivorship care plans even being utilized? Lisa and I performed a little research project a couple of weeks ago. We chose 10 patients at random and called their primary care physicians. Out of those 10 that we called, there was only one physician who had received the survivorship care plan from their patient, and it was scanned into the chart. So what we're wondering is, are the primary care physicians even looking at the survivorship care plans when they receive them? Are they just being scanned in? If not, we're wondering if there would be a better way of communicating this information to the primary care. So what do you think might be a better way of communicating this with the primary care physicians?
So I was hoping that there would be anybody out there with some suggestions. If you want to write them in or unmute yourself, you can even interrupt me. Should we send occasional oncology notes? So throughout their treatment, do you maybe want to see notes from the oncologist, so that maybe when the patient comes in for their follow-ups with you, you can address these? And how do we better communicate the recommended follow-up, the lab testing, and the imaging? Like I said, those are in the survivorship care plans. Are the survivorship care plans being looked at? We need to communicate the signs and symptoms of reoccurrence. I guarantee you these primary care physicians that are taking care of these patients are going to be frequently called with, I'm having a pain in my side, or my abdomen is painful, or anything, because these patients know that there's a chance for recurrence and they want to know what this looks like. And it would be easy for you if you had something that said, this is what to watch out for.
I know, as far as I'm concerned, every time I get any bloating or feel any pains in my abdomen or anything like that, my first thought is I'm having a reoccurrence of my ovarian cancer. So what do I do?
Right. And then there's long-term side effects just from the chemotherapy. And how do we treat those side effects? These include secondary cancers from the chemotherapy, and what those secondary cancers could be, what the signs and symptoms of those secondary cancers are as well. Does anybody have any suggestions
Yeah,
out there?
please, I'm going to take a few of you off mute, so feel free yeah, to share your thoughts, share your suggestions. Anybody out there have anything?
Okay. Well, we'll go on. If you think of anything, just interrupt. Please interrupt.
So we're going to take a few minutes and talk about why survivorship care plans are being done. So the Commission on Cancer, which we refer to as the COC, it's a program through the American College of Surgeons, the ACOS. The COC gives accreditation to cancer centers that meet extremely specific standards set by the ACOS. One of these standards is that 50% of all patients who meet the criteria, they have to be stage 1 through 3. And they have to be, it has to be in the 18 months after their initial diagnosis. And so those that are diagnosed at a certain institution, they have to receive a survivorship care plan within 1 year of diagnosis.
18 months if they are receiving, their breast cancer patients, and they are receiving long-term hormone treatment.
So what are patients in our area receiving from each institution? So the larger institutions like Renown, they will fax the survivorship care plan to the patient's primary care physician if they have the correct PCP on file, which that brings up another issue. A lot of times the oncology office doesn't know who the primary care physician is, or the patient has changed primary care, or for some reason, we just don't have that information. So they also give the patient their survivorship care plan. At Renown, they have many nurse navigators to do this. They have more than we have. St. Mary's will give the patient 2 copies of their survivorship care plan and ask that the patient give one to their primary care physician and then keep one for themselves. At Carson Tahoe, only 1 copy is given to the patient, and they are asked to share it with each of their healthcare practitioners so that it can be scanned into their chart. At Carson Tahoe, we only have 1 nurse navigator, Lisa, so she has to do these in addition to all the other duties that she performs daily.
And there's some more people that joined, so I wanted to say, we're talking about survivorship care plans and how useful they are. And if, I don't know if any of these people are physicians, but if you guys have seen these or have suggestions on ways for us to communicate with you in terms of survivorship for your patients, please ask questions, go off mute, or text it to us.
Give feedback, yeah.
Yeah.
So now let's talk about barriers to renormalizing with primary care physicians and how to break those down.
So there's a few things I think that happen with these survivorship care plans. The primary care physicians may receive these survivorship care plans, but they may just be scanned into the chart. The primary care physician may not even see them or look at them, and then they're forgotten. They're just another document in the patient's chart. The survivorship care plans can be given to the patient, and then the patient just kind of puts it in the file and forgets about it, and it never gets to the primary care physician. Also, there are clinics that are not accredited by the COC, and they don't have a nurse navigator. They're not required to do these survivorship care plans. And there's a huge clinic in Reno that is a good clinic, but doesn't have a nurse navigator. So these patients do not receive survivorship care plans. What can be done? How do these providers communicate with the primary care physicians? Again, usually if the institution has the COC accreditation, they have a nurse navigator. If the institution is not accredited, they usually don't, because the nurse navigator does not bring income into the institution. So we are not a money-making employee. We did, in our research, I found an article on the ASCO website, and in their research, they say existing research provides minimal evidence that survivorship care plans improve quality of life in cancer survivors. So again, we want to improve these people's quality of life. We want to make survivorship easier for these patients because it's going to be hard. And I would love to figure out a way that we could do that where we're spending those 4 hours a week and benefiting these patients instead of spending 4 hours a week doing something that doesn't seem to be helping. Or how can we better communicate with the primary care physicians and other physicians so that they will look at the survivorship care plan? Or how do we get this information to them so that it benefits the patients? Also, because I remember when these survivorship care plans were first brought to our attention, and they were more patient focused and they were more psychosocial focused, and they were something for the patient to look at and see signs and symptoms for recurrence and suggest psychosocial things and suggest group survivorship groups. And it has been kind of, made smaller and geared toward more the healthcare provider, which is an important thing, but maybe just oncology notes are what these healthcare providers need, and we can then focus more on our survivors and what they need themselves. So I thought, since we were talking about survivorship and normalization with healthcare providers, that maybe I would just go over a few cancers and some of the special considerations in survivorship for these cancers. And of course, we have to talk about breast cancer because that's a huge number of the survivors. Survivorship with breast cancer has gotten big because we're curing so many of these people now. So a few things. A lot of these women are on long-term treatments that can cause specific side effects. If these patients have hormone receptor positive breast cancer, we have a way to prevent recurrence with aromatase inhibitors, which prevents hormone production in the woman. So these aromatase inhibitors have all those side effects that are similar to menopause. Bone and joint pains, depression, osteoporosis, vaginal dryness, all of this. And how do we address these symptoms, and are these patients bringing them up to you? A huge way to prevent a lot of these symptoms is yoga or exercise. Yoga especially has been known to reduce the menopause symptoms, reduce the bone and joint pains, reduce the depression, even reduce the osteoporosis or osteopenia. I had one patient come to me and tell me that her primary care physician had told her she needs to go off the aromatase inhibitors because they're causing her too many side effects. And I felt like, does this primary care physician know why this patient is taking these? I don't know. So they need to, understand the specific needs of this population and the importance of trying to keep them on these drugs and suggesting ways to help with the symptoms and not taking them off the drugs.
I have a quick question.
Yeah.
Sorry, this is Bridget. What do you do in a situation like that where you're just like, she has to be on these,
Right.
this
You
medication?
try to explain to her that she needs to talk to her primary care physician, she needs to educate the primary care physician why she's taking these drugs. Celexa is a great antidepressant for people that are on these aromatase inhibitors. It really helps them with the depression, and it can even sometimes help them with some of the pains associated with it too. So, I mean, just telling, again, educating the patient why they're taking these. And I think also a lot of these patients are being put on these aromatase inhibitors and then it's not being explained to them what these do and why. I always try to use the hormones are sort of like the food for the cancer, and if we cut that food off for the cancer, then the cancer can't come back. That's the way I think about it. That's the way my brain works.
And at the Carson Tahoe Cancer Center, for these, as Lisa was saying, the yoga is very beneficial for all of these symptoms. We do offer free yoga and exercise classes, and we also offer Tai Chi. And Tai Chi, there's been many studies that have been performed with Tai Chi that proves that it is very, very effective with fatigue and some of the bone and joint pains in cancer survivors and patients, especially with lung cancers.
So head and neck cancers, they're not very common, but they have pretty specific side effects that really need long-term follow-up. Complications after treatment, the big one is trouble swallowing. It's been thought that up to 40% of these people have trouble swallowing after treatment. Most of these people go through concurrent chemo and radiation treatment. And the radiation treatment makes it hurt so bad sometimes that they cannot even swallow water. So a lot of these people end up with feeding tubes just to get them through the treatment so that they can get nutrition and hydration while they're receiving this treatment. That pain ends up causing them to not be able to swallow afterwards. And so speech therapy is super important with these people. I try to get them referred to speech therapy at the beginning of their treatment, not after their treatment, but a lot of times this does not happen. And a lot of times the patient will just think it's normal, that their swallowing will never be back to normal. And it's important for the primary care physicians to understand that this maybe needs to be followed up on, and maybe this patient does need to be referred to speech therapy. I know a lot of you guys are rural and you may not have it there. There may be some web-based, like on YouTube or something, which would be a good thing to look into. Like on YouTube or something about learning the exercises they need for that. Weight loss is huge too. Again, if you're having trouble swallowing, weight loss is going to come right with it. And these people have their stomachs have shrunk. They're not able to eat as much as they used to. We need to build these people back up. Again, and also depending on their surgery, they may end up with dumping syndrome. So we need to talk to them about eating frequent, smaller meals, what they need to eat, the types of foods they need to eat to prevent the dumping syndrome. And the last one we'll talk about is colon cancer. So again, chronic diarrhea, how do we manage the chronic diarrhea? What's the best diet for these people in terms of their chronic diarrhea? Do they need to be on some sort of anti-diarrheal medication chronically? And a lot of these people end up with permanent ostomies. The big thing with the ostomies is ostomy support groups. And the ostomy support groups, I think, are so important. A lot of the other cancer support groups, sometimes people don't want to be involved in them because people pass away in these support groups, and maybe this isn't something that they want to deal with. Whereas the ostomy support groups, you don't really have that, and you just have people coming in talking about how to care for your ostomy, talking about, this is something that's worked great for me. It's super important because taking care of your ostomy is sometimes really confusing. Also, these people, most of them have received a chemotherapy drug called oxaliplatin, and they can have permanent neuropathy in their hands and their feet. And how to treat that neuropathy, maybe some different drugs to use, or teaching them how to live with the neuropathy in terms of, you know, wearing shoes when it's hot. I had a patient who went to the water park with his grandson and ended up with third-degree burns on the bottom of his feet and had no idea until it started oozing and he ended up in the hospital with an infection. So this is important to talk about these people. And that's it.
So to summarize, I'd like to say that right now, currently, the only way to get information to the primary care physician in order to renormalize healthcare is through the survivorship care plans, and we're not certain this is the most effective way. We need to figure out a better way.
All right. Again, if there's anybody that has questions, please let us know.
Yeah, so we've got quite a bit of time left, so please, feel free to ask questions. Unmute yourself with the icon in the lower left corner of the Zoom window, or *6 if you're joined by phone, or rather using the chat function.
Also, if anybody ever needs help with any of their patients down the line, I don't know if there's a way for you guys to share my information with them, but I don't mind sharing. We have a lot of rural people at our cancer center.
Great. So this is Troy Jorgensen back here in the corner. You can email me, and I'd be happy to connect you with Lisa. So I'll share my email through the chat too.
And when it comes to like non-clinical questions, psychosocial support groups and stuff like that, they could get in touch with me.
Great. So yeah, any questions, comments, thoughts out there? We want to hear from you right now. We've got lots of time left. So again, please unmute yourself. Well, Bridget, do you want to do the wrap up and everything?
Absolutely. So thank you so much to you, Lisa, and to you, Sharon, for sharing that information. It's super important, and yeah, hopefully we can find a better way. That and thank you everyone for joining and for your input. And you know, if anything comes to mind after the webinar is over, please feel free to either email Troy or myself. My email is bridget@nevadacancercoalition.org. So I wanted to just do a quick reminder for the upcoming Nevada Cancer Control Summit, which is going to be on September 16th at Whitney Peak here in Reno. The summit is hosted by Nevada Cancer Coalition, and it's a one-day statewide conference featuring presentations on targeted topics across the cancer spectrum. So this year, we are really going to be focusing on some survivorship. We are going to have a primary care track that will be really geared towards primary care physicians and how to help cancer survivors. So it should be great. There's also, I believe, going to be a psychosocial component of the Control Summit this year. And then please join us for the next clinic in this series. We actually only have 2 more left. This has been such a great opportunity for us to share educational opportunities with providers. But the next clinic is on May 10th, and the topic is going to be on nutrition. So it will be presented by Sue Chapman, who's a registered dietitian with St. Mary's Regional Medical Center. So thank you so much for joining. And yeah, if there's any, we do also have this poll, which it would be wonderful if everyone could take a quick second to complete the Cancer Survivorship Post Survey. We want to make sure that everyone is finding this information useful, and hopefully, you know, if they are, we can continue to do a series that is similar to this and continue to expand it out. So please take the opportunity to take the poll if you could. We'd greatly appreciate it. Thank you. Thank you.
Thank you so much, everyone. Hope to see you next time. Get in touch with me in the meantime if you have questions or I can help with anything.
Thanks,
Bye.
everyone. Have a great day.
Thank you. Bye-bye.
Thank you.